Cancer is one of the most complex and misunderstood diseases in modern medicine, yet it is also one of the most intensely studied conditions in human history. Today, millions of people around the world are living longer and healthier lives after cancer treatment, largely because our understanding of how cancer develops and how it can be treated has improved dramatically over the past few decades. To understand cancer treatment, we must first understand what cancer truly is and what happens inside. Cancer occurs when normal cells lose the ability to regulate their own growth. In a healthy body, cells grow, divide, perform specific functions, and eventually die through a natural programmed process known as cell death. This balance keeps tissues functioning normally. However, when genetic mutations damage the DNA that controls cell behavior, certain cells begin to divide uncontrollably. Instead of stopping when they should, these abnormal cells continue multiplying, forming masses of tissue known as tumors. While some tumors remain harmless and localized, malignant tumors invade surrounding tissues and gain the ability to spread throughout the body. This spreading process, called metastasis, is the primary reason cancer becomes life-threatening. Cancer cells can travel through the bloodstream or the lymphatic system and establish new tumors in distant organs, such as the lungs, liver, brain, or bones. In many cases, it is not the original tumor that causes death, but the failure of vital organs affected by metastatic disease. Cancer development is usually not sudden. Most cancers grow silently over many years before symptoms appear, which explains why early detection plays such a crucial role in survival outcomes. Multiple factors contribute to cancer formation. Lifestyle risks such as smoking, excessive alcohol consumption, poor diet, obesity, and lack of physical activity increase the likelihood of cellular mutations. Environmental exposure to radiation or toxic chemicals can also damage DNA. Some infections, including certain viruses, are linked to cancer development. Aging itself is another major factor because DNA damage accumulates naturally over time. In some individuals, inherited genetic mutations increase susceptibility, although hereditary cancers represent only a small percentage of total cases. Once cancer is diagnosed, physicians determine how advanced it is through a staging system. Early-stage cancers remain confined to one location and are often highly curable. Intermediate stages indicate local spread to nearby tissues or lymph nodes, while advanced stages involve distant metastasis. The stage at diagnosis remains the most powerful predictor of survival. A patient diagnosed early may achieve complete cure, while the same cancer detected late may require lifelong treatment. Modern cancer therapy typically involves a combination of treatment methods rather than a single approach. Surgery, chemotherapy, radiation therapy, targeted therapy, and immunotherapy are used strategically depending on cancer type and stage. Surgery aims to physically remove tumors when possible, especially in early disease. However, even after successful surgical removal, microscopic cancer cells may remain in the body, which is why additional therapies are frequently recommended. Chemotherapy is one of the most widely known cancer treatments. It involves medications specifically designed to destroy rapidly dividing cells. Because cancer cells multiply much faster than most normal cells, chemotherapy drugs interfere with their ability to replicate DNA and divide. These medications circulate throughout the bloodstream, allowing treatment of cancer cells that may have spread beyond the original tumor site. Chemotherapy may be administered before surgery to shrink tumors, after surgery to reduce recurrence risk, or as the main treatment when cancer has already spread.
Despite its effectiveness, chemotherapy also affects certain healthy tissues that naturally divide quickly. Hair follicles, digestive tract lining, and bone marrow cells are particularly sensitive, which explains common side effects such as hair loss, nausea, fatigue, and decreased immunity. Importantly, these side effects are usually temporary because normal cells retain the ability to recover once treatment cycles are completed. Radiation therapy works differently from chemotherapy. Instead of circulating drugs throughout the body, radiation uses high-energy beams to precisely target cancer cells in a specific area. These beams damage the DNA inside tumor cells, preventing them from reproducing. Over time, the damaged cancer cells die, and the tumor gradually shrinks. Modern radiation technology allows physicians to deliver treatment with remarkable precision, minimizing injury to nearby healthy tissues. Radiation therapy is commonly used after surgery as a primary treatment for localized cancers or to relieve symptoms such as pain or pressure caused by tumors. A common concern among patients is what happens to chemotherapy drugs after treatment. Once inside the body, these medications do not remain permanently. The liver metabolizes the drugs into forms that can be eliminated, and the kidneys remove them primarily through urine. Smaller amounts may leave through stool or sweat. Most chemotherapy agents are largely cleared within 48 to 72 hours, although their biological effects on cancer cells continue long afterward. Radiation therapy, by contrast, introduces no chemicals into the body. The radiation energy disappears immediately after treatment, meaning patients do not become radioactive and pose no risk to others. The first 72 hours following chemotherapy are considered an important recovery period. Patients are generally encouraged to stay well hydrated to support kidney function and assist natural drug elimination. Light, nutritious meals help maintain liver metabolism, while gentle movement improves circulation and overall recovery. Good hygiene practices are recommended because trace amounts of medication may be present in bodily fluids during this time. Contrary to popular belief, there is no scientifically proven detox drink or supplement capable of removing chemotherapy drugs faster. The body's own liver and kidneys remain the true detoxification system.
Interestingly, many patients feel relatively stable immediately after chemotherapy, but experience increased fatigue several days later. This delayed effect occurs because chemotherapy temporarily suppresses bone marrow activity, reducing white blood cell production. Around 5 to 7 days after treatment, immunity may reach its lowest level, increasing susceptibility to infection. Blood counts typically recover before the next treatment cycle begins, allowing therapy to continue safely. In recent years, cancer treatment has entered a new era through targeted therapies and immunotherapies. Targeted therapies focus on specific molecular abnormalities unique to cancer cells, allowing treatment that is more precise and often less toxic than traditional chemotherapy. Immunotherapy represents an even more revolutionary approach by stimulating the patient's own immune system to recognize and attack cancer cells. Some individuals with previously incurable cancers now achieve long-term remission due to immune-based treatments, transforming expectations for advanced disease. Cancer treatment outcomes also vary depending on access to medical technology and specialized care. Countries such as the United States and Singapore lead global oncology practice due to advanced imaging systems, precision radiation equipment, genetic testing capabilities, and early availability of newly developed medications. However, medical experts consistently emphasize that survival depends far more on early detection than geographic location. A cancer diagnosed early and treated promptly often has an excellent prognosis regardless of country, while late-stage disease remains challenging even in the most advanced medical centers. One of the most important truths about cancer is that many forms are now curable. Early detection of breast cancer, prostate cancer, thyroid cancer, colon cancer, and several other malignancies results in very high long-term survival rates. Even when cure is not achievable, modern treatments frequently allow patients to live meaningful and productive lives for many years by controlling disease progression.
Cancer recovery extends beyond physical treatment. Emotional resilience, psychological support, nutrition, Rehabilitation and long-term medical monitoring all play essential roles in survivorship. Patients often face anxiety, fatigue, and uncertainty after treatment, making supportive care an integral component of modern oncology. Prevention and screening remain powerful tools in reducing cancer mortality. Avoiding tobacco use, maintaining a healthy weight, engaging in regular physical activity, receiving recommended vaccinations, and undergoing routine screening tests significantly lower cancer risk or enable earlier diagnosis. Screening programs have saved countless lives, precisely because cancer detected early responds far better to treatment. Ultimately, cancer represents a breakdown of normal cellular regulation, but modern medicine has developed multiple strategies to restore control. Surgery removes tumors, chemotherapy treats disease throughout the body, radiation therapy targets localized cancer, and emerging therapies harness genetics and immunity to fight malignancy more intelligently than ever before. While cancer continues to pose serious challenges, advances in research, technology, and early detection have fundamentally changed the outlook for patients worldwide. Today, cancer treatment is no longer defined solely by survival, but by quality of life, long-term recovery, and hope. Understanding how cancer develops and how treatments work empowers patients and families to make informed decisions, reduce fear, and recognize that many cancers, once considered untreatable, can now be managed or even cured. Modern oncology continues to evolve, bringing humanity closer to transforming cancer from a deadly disease into a controllable condition and, increasingly, a survivable chapter of life rather than its ending.